Patients come to me sometimes with numb hands, and they know they have carpal tunnel syndrome. Believe it or not, most of the time it is carpal tunnel syndrome. They're right. And typically carpal tunnel syndrome is numbness in the thumb, the index, maybe the middle finger. If it's numbness in the pinky and the ring finger, a lot of times that's coming from behind the elbow. That's something called cubital tunnel syndrome. It's a different nerve. But carpal tunnel syndrome, most of the time, can be treated non-operatively. And we'll typically start with bracing. And I would say the majority of patients respond to bracing. And the idea of the brace is to keep the hand in what we call a neutral position. We don't want it extended and we don't want it flexed for a long period of time. A lot of times I'll start with night bracing because that seems to be pretty effective for a lot of patients, because a lot of patients kind of sleep like this and they wake up shaking their hands to wake it up. If the brace doesn't work after about 3 weeks, I'll typically try an injection. That is a good diagnostic procedure, but also therapeutic in a lot of patients. If none of that works, then we proceed with surgical intervention. And that's where we release the tight gristle that's pressing on that nerve to try to give it some breathing room and get the sensation back in the hands.